Thank you so much, Katharina. And 안녕하십니까? 오늘 여러분을 만날 수 있어서 참 반갑습니다. 저는 미국에서 태어났습니다. 그리고 나는 Korean American임을 매우 자랑스럽게 생각합니다. 이제부터는 영어로 하겠습니다. Thank you very much, and welcome to Washington, D.C., and welcome to the White House. And I am so humbled and proud to stand before you and to say those words. And I am so humbled and proud to see all of you assembled here so that we can celebrate our accomplishments as a Korean American community and discuss the issues before us and contribute to making this country stronger. I am so thrilled to hear the inspiring words of our chair, Katharina Min, and it was very, very touching to hear her say thank you to the parents who have sacrificed. And when those parents stood up, I thought about my own parents who also sacrificed to make this journey. Many of you may know about my parents who are very well known, Ko Kwang Lim and Chun Hae Sung. And they journeyed to this country a generation ago searching for the American dream. And I think about their journey every day on this job. Growing up, they told me and my brothers and sisters that we were very fortunate to be born in the United States, that we had to work hard and be all that we could be with respect to achieving our full potential. They said that we should never take freedom and democracy for granted, and we should cherish the United States. And also they stressed that we should be, after getting our education, living a life of higher purpose. And those words inspire me every day. Even though my dad passed away some 20 years ago, I know he is looking proudly down from above today. And I know that his legacy and the legacy of all of you who have journeyed to this country gets stronger through meetings like this. And so I am so grateful to see all of you and talk to you especially about some tremendous promise right now in our country with respect to health. I chose to take the gift of being born in this country to dedicate myself to medicine and public health. And as many of you know, I am a physician. I have cared for patients for over 30 years. I've trained in multiple fields. But early on in my career, I saw that there were many ways to making our society healthier. We need good doctors and health professionals to deliver hands-on care, but we also need many others in our society to contribute to prevention and public health at large. Every day as Assistant Secretary, I think about what health is all about, what we're trying to achieve as an increasingly diverse society, and one can only conclude that your good health is a gift. If you don't have your health, it's hard to live your full potential in this country. And in fact, Reverend Martin Luther King once said, "He who has health has hope, and he who has hope has everything." And those words drive me in my current position because we need to have a country and a society where everyone has a chance to achieve their full potential for health, regardless of their place of origin. As you heard, I was confirmed by the Senate and started my job in 2009 after being appointed by the President. And shortly after the Obama administration began its first term, I had an extraordinary experience of standing behind the President with my brother Harold, who also served in the first term as legal advisor in the State Department, as the President signed an executive order reestablishing and re-energizing the White House Initiative on Asian Americans and Pacific Islanders. Later on today, you're going to hear from Kiran Ahuja, the executive director of that initiative. But through that initiative, we've had many meetings like this, now reaching out to many Asian American and Pacific Islander groups. I am very, very grateful to Gautam Raghavan and his colleagues for bringing our groups together so we can celebrate progress, learn from one another, and talk about our future. So right now, you know that we are living in an absolutely historic period of our country's journey with respect to health. Everybody is talking about the Affordable Care Act, known by some as Obamacare. And you know it's not easy to navigate the health system right now for anyone in this country. It's a very complex system. I know that as a physician, and I know that as one who has helped my relatives, people like all of us here, trying to navigate the system and get the best care possible. With respect to Korean Americans, you'll notice on the handouts that some 25% of us are uninsured. That's 1 in 4, much higher than the national average of some 16%. And so access to care is a real challenge for our community, and that's something we should all recognize immediately. And then once you do have good care and try to navigate the health system, there are all sorts of barriers, cultural, linguistic barriers for Asian Americans and Korean Americans in terms of receiving the best care possible. Again, I know that as a physician who has cared for patients from all different backgrounds, and I often reflect on my own personal experience as a young physician when my grandmothers, who were then alive and trying to get the best care possible through their doctors, were encountering the U.S. healthcare system. My relatives would call me regularly and say, "Howard, call Grandma's doctor, talk to him or her, make sure that Grandma's getting good care." So, of course, I always did. And my grandmothers got excellent care in the U.S. health system. But after every conversation, I'd always put down the phone and think to myself, what about other older newcomers to this country who don't have doctors as grandsons checking in on them? What about them? And do we have a health system that really is welcoming to everybody regardless of their race and ethnic background? And then for those of you who are interested in the policy issues, we need the best data possible on all of America. And this is a country that's getting increasingly diverse, as you know. And especially when I was a younger public health professor looking at Asian American health issues, and I'd look for data, the answer I would always get back is TIALOD. TIALOD. There is a lack of data. You would look for Asian American data, there'd be no data. You look for Korean American data, and of course there was no data. And the subliminal message was, if there's no data, there's no problem. So now we have a different era because the Affordable Care Act was signed into law by the President in March of 2010. And we have tremendous opportunities before us with respect to better insurance coverage, better prevention and public health, a more culturally welcoming health system, and access to better data that will reduce health disparities in the future. So let me just share some developments in that area for you. First of all, I hope you know that because of the new law, everybody can get health insurance regardless of your health condition, regardless of whether you have a pre-existing condition or not. And so that's a huge step forward in terms of providing access to people, especially for us Korean Americans. We already have a provision where young adults under age 26 can obtain health insurance coverage on their parents' plans. And because of that, nearly 100,000 more Asian American and Pacific Islander young adults are covered by insurance, so that's a big step forward. Because of the Affordable Care Act, we are trying to eliminate barriers to good prevention and public health. So, in fact, since the Affordable Care Act was passed, close to 4 million Asian Americans and Pacific Islanders have better access to free preventive care, such as mammograms, hepatitis A and B vaccines, and other critical prevention interventions. And now we're in a critical phase because starting October 1st, if you're not insured or you're underinsured, you can sign up for coverage in a process that's called open enrollment. And starting January 1st in every state, you can access insurance through what are called marketplaces. And these are online resources where you can conveniently look at your options, compare the plans that are available to you, and choose one, the one that best meets your needs. Now, if you're not very familiar with all this, just a couple very key and basic suggestions. You can go on to healthcare.gov, and our Department of Health and Human Services has worked hard to make that readily accessible, readily understandable. Or you can call a toll-free number that opened up several months ago, 1-800-318-2596. If you call that toll-free number anytime, 24/7, a trained customer service representative will chat with you and answer questions you might have about how to access insurance coverage. The representatives are able to speak in English or Spanish, but there are also assistance services in over 150 additional languages, including Korean. So we're very proud of that because we're trying to make this as personal as possible for people who have been shut out of the marketplace for way too long, get people the insurance coverage they need and deserve, and also help contribute to a more welcoming health system for the future. If you go on to healthcare.gov or call this toll-free number or ask about your options, you may also be eligible for subsidized insurance, for premium tax credits. And so you have to share your employment history and your income history, but we want to make insurance affordable for people. We want to make this easy for people. The application online is only 3 pages long. And so we're in a critical time where we're trying to just tell everyone, please join us in sending out this message that if you do not have insurance or you're underinsured, this is the time, this is the moment for you. This is the time to get people insurance coverage they need and deserve. So that's what open enrollment, starting 60 days from now, in fact, is all about. And starting January 1st, 2014, we will see the Affordable Care Act in full implementation, and you will see what a transformative opportunity this is for our country. One more website to share if you want written resources about these options. You can visit marketplace.cms.gov, and you can download and print out materials. There are several resources in the Korean language as well. I think some of them are actually here for you to share. So again, we want to make this as accessible and as easy for people as possible. Now, we have also, with health reform and the Affordable Care Act, a great opportunity from a bigger picture about collecting data so we can understand the health challenges that face our Korean American community. I know that you can relate to the fact that years ago, many of us would be counted, if we were counted at all in federally funded surveys, in the other category. The categories used to be black, white, and other. And then over the years, an Asian American category has emerged. But because of the Affordable Care Act and a particular section called Section 4302, there are new data collection standards for race, ethnicity, sex, primary language, and disability status. So, for example, in the Asian American category, there are now 7 subcategories that are required for all federally funded surveys: Asian Indian, Chinese, Filipino, Japanese, Korean, Vietnamese, and other Asian. So that means the Korean Americans now are counted. And if you count people everyone counts. Even in the Pacific Islander category, there are 4 subcategories: Native Hawaiian, Guamanian or Chamorro, Samoan, and other Pacific Islander. So this is a major national push to get more detailed information, what we call granular data, that will help researchers and policymakers identify the challenges specific, not just to Asian American and Pacific Islander populations, but specifically to Korean American populations, and then help us plot better strategies to address those disparities and eliminate them. The message is the data is coming, the data will be available, and then everyone counts. There's also an effort with respect to asking questions about English proficiency in a standardized way. And of course, people with limited English proficiency encounter many barriers in this country. We have all lived through them. Our family members have all lived through them. So we want to have a better understanding of who the subpopulation is and how we serve that subpopulation better. We can do that through efforts like this. And then my final comment has to do with improving the health system so it's more welcoming to people of all different backgrounds. Recently this year, we released what's called the Enhanced National Standards for Culturally and Linguistically Appropriate Services, CLAS, C-L-A-S, just one S. Culturally and Linguistically Appropriate Services in Health and Healthcare, CLAS standards. And this is a framework that involves all health and healthcare organizations where the message is you organizations are taking care of an increasingly diverse clientele. And it's really your responsibility to make the services you deliver to your clients as culturally and linguistically appropriate as possible. This means raising awareness throughout the whole organization, training providers, changing signage, and basically recognizing culture as a vital part of one's background and one's life on this earth. We define culture broadly. It includes factors such as race and ethnicity and language, of course, but also spirituality, disability status, sexual orientation, gender identity, and geography. And of course, we want the goal to be that every health and healthcare organization delivers services in a culturally respectful and linguistically responsive way. That's what the release of the national CLAS standards was all about. It was very inspiring for me to hear at the press conference where we unveiled these new CLAS standards, the CEO of the American Hospital Association saying that he felt strongly that these new standards were critically important for all the hospitals in the United States. Not just because it was the right thing to do, but because it was also good for business. And so we are trying to advance a future in this country where we have a more welcoming health system, a real system that prizes prevention and public health as well as treatment, that recognizes the diversity of this country that's growing by the day, and that respects the contributions of the groups in the society, with Korean examples as Korean Americans as our great example today. So in closing, I am very, very proud to be here with you. I am so honored to be with you. I never dreamed growing up that there'd be a White House conference on Korean Americans. I never dreamed growing up that I'd be speaking at a White House conference on Korean Americans, but here we are, and this is history. Gautam, thank you again for organizing this. Katharina, thank you again for bringing SICA together to bring us as one community to address all these critical issues, and I'm very, very humbled and proud to work with you to make our country stronger for the future. Thank you very, very much. I think I can take a question or two. Yes?
Thank you very much. It's an honor to be here. My name is Youngsuk Victoria Sa. I'm a plastic surgeon. Most of my work with cancer patients, so I know how important it is to have this Affordable Care Act. My question to you is that there's a lot of myth and mystery surrounding this care, especially among the physicians. And I kind of feel like the government has not really done too much to really educate the physician population. Whether we like it or whether we don't like it, it is here. We have to work with it. We have to provide services to our patients. And what is your plan right now? October 1st is nearby. What is your plan to educate the physicians so that we can actually participate in a correct way, in a way so that we can better prepare our patients as well?
Thank you. That's a great question. And first of all, thank you for your commitment and your service. Of course, we are reaching out to every part of society right now to send the message that this is a historic time, that everyone needs to be involved, to send the message about the importance of outreach and enrollment for people who need and deserve insurance coverage. And physicians and healthcare providers like us can play a major role. We are actively working with physicians, nurses, physician assistants, public health professionals from coast to coast to send this message. We've funded colleagues at every community health center in this country, for example, to do outreach. And you know, the community health centers are taking care of many underserved people, over 20 million, in fact, in this country. In June of this year, I and Marilyn Tavenner, who is the newly confirmed administrator for CMS, the Centers for Medicare and Medicaid Services, wrote a little piece in JAMA, the Journal of the American Medical Association, which reaches just about every physician in the U.S., I believe. And it's a short piece called Connecting to Health Insurance Coverage. You can read that in under 10 minutes, and it explains some of the basics that I just reviewed for you today. So what we're trying to say to all health providers is make sure your patients have insurance coverage that they need and deserve. If they don't, tell them this is their opportunity to sign up. Direct them to healthcare.gov or to our 1-800 number for starters, and get everybody in their family and their community involved, and that's what we're trying to do from now through October 1st, January 1st, and beyond. Yes, sir.
Dr. Ko, I'm Samuel from Massachusetts. Since you've been in Massachusetts, I'd like to ask you this one question, very simple. They talk about Romney Care in Massachusetts. Now, we're talking Obamacare. What is the difference between Romney Care and Obamacare? They're talking about it's essentially the same thing. I'd like to ask you a question. Thank you.
Well, thank you. I am from Massachusetts, and you know that Massachusetts started health reform in 2006, and because of that now has the lowest rates of uninsured of any state in the country, about 2.5%. And many of the principles of health reform in Massachusetts were ones that guided the national conversation and led Congress to pass the Affordable Care Act, which was signed into law in March of 2010. So the principles are really the same, trying to get individuals to sign up, making it easier for small businesses to sign up, establishing marketplaces, or some people call them exchanges. In Massachusetts, it's called the Connector, and it's been very well received. And Massachusetts has been a wonderful example because it's been widely accepted. It's driven the rates of uninsured people down to historic lows for the country. The outreach has been excellent. The Boston Red Sox were involved. And so we want to see the same model happening coast to coast here. Now, each state is different, of course, and the leadership of each state is different. Many states are considering expanding Medicaid as we speak, so that complicates the decision-making state by state. But we are hoping that over time we will see the same successes that Massachusetts has. Thank you for your question. Maybe just one more. Hi.
So I just wanted to thank you and say how much I appreciate this opportunity. I have not had the good fortune of good health, and I've met many doctors who I believe understand their field in the best way they can, but I don't believe that they really understand illness. And I've also asked a good number of doctors how they define good health. And I have received appallingly bad answers, to be quite simple. So I guess my question for you would be this. I think I'm going to guess that there's going to be a distinction between what you believe to be personal good health and what the government believes to be personal good health. But I'm not sure. So I was wondering if there is that distinction. And if there is that distinction, then what that distinction would be. Because I've asked a lot of people, you know, how they feeling these days, if you're healthy, whatever. And there's not too many people who are healthy, in my opinion. And I've gone to really good schools. I know really people who are well educated, should know what it is to be healthy. I met a lot of doctors who don't seem to be healthy. So my question is, like, how do we as a society define good health? And do you believe that it's being played out in the healthcare system? Because I don't believe that.
Okay. I love ending on a philosophical note. But it's very relevant. And you've asked me one of my favorite questions, because every day on this job I think, what is the definition of health? How do we define success? How do we know that we're helping people? How do we know we're making our country stronger and healthier? There's a definition from the World Health Organization that says health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. I love that definition, so I'll say it again. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So what that definition means is that health is more than just taking care of somebody when they're sick. It's really helping people reach their full potential for health, which is a gift. It means a state of well-being, not just physically, but mentally and emotionally. Our emotional well-being and our mental health is very, very important. The president has spoken quite passionately on that. We need this for not only individuals, but our society as a whole. And that's what really public health is all about. And so that definition is broad, it's inspirational, but it applies to everyone, regardless of your culture or where you were born or what language you speak. And when you have that, you have an incredible gift, and you have hope for the future. And so that's what we want really for everybody in this country. Thank you very, very much. Nice to see you.